Doctors of Reddit, if free healthcare for all happened tomorrow in the US, what pros and cons would you see in your profession from day to day? As a cancer doctor, there are many people who avoid going to the doctor due to fear of cost. Some people do not get treatment for cancer at all. Some people wait until it is late and their cancer has already spread. But most importantly in my mind, many people do not get the routine cancer screening or tests done when they first have symptoms. It is true that even those with insurance sometimes have other barriers to healthcare, including things like low health literacy, denial, alternative treatment preferences, misdiagnosis, etc. But affordable access to healthcare saves lives and costs less. As an example, my landlord in New York was in the Army Reserves, and just before his time was up he was called in to do 2 tours in Afghanistan. He is currently self-employed as a plumber and owns several rental properties. Several years ago he noticed a small lump on the side of his neck. He ignored it at first, but then when it started to grow he made an appointment with his PCP at the VA, who ordered an ultrasound, then a scan. It was eventually biopsied and shown to be cancer. He was treated with radiation alone, and 9 years later he remains completely cancer free. Had he not had health insurance, as is the case for many self-employed people in America, he may not have had a PCP, or the cost may have caused him to delay care, or delay scans, etc. If he had waited, he very easily could have required extensive, invasive and disfiguring surgeries, months or years of chemotherapy, feeding tubes, complications, etc. Not only would this have cost much more to our healthcare system, he also might be dead despite all that. Having access to free healthcare quite literally saved his life, and was much cheaper overall. TLDR, cancer sucks. Cancer sucks much more if you are uninsured. I had a co-worker at a new job who had kidney failure and was waiting for insurance to kick in after 90 days to go to the doctor. He was in pain every day and was limping. He was 28 at the time. Now when I had a recent comment talk with him on a Facebook post about universal healthcare, he was against it firmly because his money would be paying for other people's care. And I was like, Methodika, you were on the other end of the stick, and now that you make almost 6 figures working 10 hours a day you say duck them. This was at a car dealership, shaking my head. FM Doc here. The pros of mitigating what is best for the patient without having to worry about what is going to destroy their finances really outweigh any of the cons I can think of, to be honest. Outside of people with low health literacy or outright ignorance, the biggest barrier to getting routine screening and follow-up is cost. Same goes with medication. Seriously, insurance formulas can change up to 3 times a year, and when they do, your 5 Pro Air inhaler is instantly $170 unless I switch it to a 5 Ventolin inhaler. Sometimes it is just as simple as putting substitutions permissible on the script, but not always. I did honestly and genuinely like to hear from anyone in primary care who can think of any substantial cons to universal healthcare that would outweigh the benefits. I have to say that I really appreciate all the reasonable discourse I have received. Even if we don't see eye to eye on the matter, it is really encouraging that Reddit doesn't always have to devolve into vitriolic cynicism. However, if you have read some of my responses, you will see that I have a lot of patience and I live in a small area. Today was kinda a fluke for me, as I usually don't have this kind of time to dedicate to responding to people on Reddit. Even if I try to stay semi-active around here, I will probably wind down on responses right now. But I will try to chime in whenever possible if anyone feels like they have a heartfelt question and cares about the feedback of a humble, rural family doctor. Laughing. Thanks everyone. Fun fact. It is technically illegal for pharmacists to change between Ventolin Pro Air Prevental or between generics of the same, because they are not AB rated equivalents due to some clerical nuances. We also can't change tablets to capsules or vice versa. The differences between these medications can literally be hundreds of dollars. We do anyway, cause damn the man. Tomorrow. Okay, let us have fun and be very literal about this. For context, I'm an emergency physician in a smaller community, so I'm accustomed to seeing a mix of people who are privately insured, people with Medicare, Medicaid, vets from the local VA population, which is unusually large, and people who have no insurance. If healthcare for all popped into existence tomorrow, it would be a huge mess. The system would reel with the shock. Primary care, particularly, would both be blessed to no longer shoulder the burden of underinsured patients needing primary care and stressed. Single-payer systems very quickly understand that investing in preventive care saves dollars. So those systems build structure for providing health education, diet education, exercise education, getting everyone screening tests and awesome early diabetes care. That is a lot of catching up. Because here with our current system we disincentivize lots about management of chronic illness. It can be hard to get nutrition or diabetic test strips or blood pressure medication covered. From what I hear, in single payer systems, if a patient inaccurately triages themselves, the system gains permission to redirect them. I'm currently the safety net for how messed up access to care is. I legally cannot refuse to see that one guy who shows up for athlete's foot by ambulance, or a rash that is, been the same for 4 weeks, but she is, been unable to get into primary care, or the guy who ran out of diabetes meds, or the ankle that was sprained yesterday but still hurts. I understand my role. I understand why this safety net is important in the US. I would be very happy to instead be able to tell these people you belong at primary care and poof you have the ability to get in within a few days. Or you belong at the sports clinic and poof you can go there tomorrow. I do love my job, but I do spend a lot of time patching holes in access to care. My training is in resuscitation, intubation, reducing dislocated joints, sewing lacerations, diagnosing sepsis or new psychotic breaks or anaphylaxis. I currently spend about a quarter of my day hating the US system's barriers to effective primary and preventive care. Not my training. Not a good sign for the patients that they have been forced into that place. Not the smoothest way to navigate the system. Sadly, it clutters up time I could be getting to the next emergency patient. I also spend a fair bit of every day talking to frightened or angry people about their healthcare costs and battling the effects of those costs. A young woman whose prescribed insulin was too expensive and she felt uncomfortable advocating for herself and instead went into a diabetic coma. Outcome was good, but her ICU admission venous pH was 6. 68, the lowest I have ever cared for that lived. I thought she was going to die. Her mother had not known she was going without. People want to know the cost of that cord scan to diagnose kidney stones. There is no way for me to possibly know that. It varies thousands of dollars between plans. I ache around this. It is terrible not being able to engage in transparent discussion. Until we go single payer, I will never be able to tell a patient how much a gram of acetaminophen costs for them. For many, it is zero and a great help in multimodal analgesia. For some, it is some stupid inflated cost. I don't know. I can't have an hour-long insurance company call with each patient. I need to see 5 per hour, including time spent talking to specialists, doing procedures, etc. I would sincerely love to not do that stuff anymore. No more my meds used to be covered, and no more I couldn't afford the cost of treatment, but now I'm worse. I think it will be a painful, bumpy transition to single payer, and I may indeed take a pay cut, though I think that is not as bad as some make it out to be. Aussie and Brit docs as compared to their peers do okay. I feel very strongly that our nation needs this. I feel it deeply, and the lesson is ingrained more deeply every time I go to work. People want to know the cost of that cord scan to diagnose kidney stones. The way co-pays work for this is stupid too. As a follow-up to several bouts with cancer and several surgeries, I get scans every 6 months. I used to get a MRI abdomen and pelvis with and without contrast, and a chest cord. The MRI takes the better part of 2 hours in the machine. I have to change into a hospital gown. There is an fourth in my arm. The pump for the contrast itself, and 3-4 adtechs. So it is costly. The cord takes about 5 minutes, and I do it in street clothes. If I get all of the above scans done at the same time, in the same facility, my copay is $40. Since I have been clear for 3 years, my doc said I can bump the MRIs to yearly, but still needed the chest cord at 6 months. The copay for just that was still $40. There are a lot of things that are good effective treatments, supported by evidence, that Medicare does not cover for archaic and obsolete reasons. The somewhat free market of insurance has made carriers have to compete somewhat to offer treatments THST patients want and need. With one carrier, those patients may find themselves out of pocket for services that were previously covered. You might not see this competitive benefit when you buy insurance because you may not have an option when your company offers one brand. However, the company has hopefully looked at and compared various benefits packages. Also, for even more archaic and obsolete reasons, vision and dental are separate, as if your eyes and teeth are separate from your overall health and quality of life. This is because teeth were previously considered non-essential bones. Yes, not needing 5 people in the office just to constantly phone insurance for verification would be great. If you see a healthcare office, one is scheduling appointments, 5 are waiting on hold at insurance carriers chasing verification of benefits, or chasing down bill payment. Insurance often likes to run small offices around in circles for the maximum amount of time and refuse to pay the actual costs of care. This leads to the bill going directly to the patient who has already paid their insurance, or to the doc writing it off as a loss. Can't have an employee sit on the phone for hours when the hourly rate is $25 and the bill is $50. Insurance companies know this and abuse it. There are a lot of things that are good effective treatments, supported by evidence, that Medicare does not cover for archaic and obsolete reasons. Australian here in those cases my private health fund covers it. And anybody who can afford to have medical insurance at all in the US could easily afford our private system, which you get on top of the completely free public one. We have health savings accounts and such over here too. Sometimes it covers it, sometimes number. What if you lose 300 pounds of fat and want to get the excess skin removed? Well, in the UK, that is an elective procedure, while I would fight that under medical necessity in the States. The biggest counterpoint a lot of people hide behind is that national healthcare would not be a perfect solution, and since perfection will never exist, they use that as a stall tactic. We are not looking for perfect, we are looking for improvement. There is no better way to spend the tax dollars they are already stealing from us than on education and healthcare. What that could do for our GDP, it would probably be the most effective American stimulus in history. I'm a doctor. Pro people could seek medical care without worrying about ending up bankrupt. They could also access preventative healthcare to avoid bigger problems in the long term. Although Americans are really bad about this, even when their healthcare is paid for, a lot less money going into the healthcare system. I don't care as much about my paycheck getting smaller, but there are a lot of smaller community hospitals operating on razor-thin margins that would likely be forced to close. Paradoxically, this could result in many people losing access to care. TLDR, I'm definitely in favor of ensuring universal access to affordable healthcare, but things are shockingly more complicated than declaring medicine is free now. I just want the cost of health insurance to go back to pre-2008 recession levels. Example, my first son was born pre-recession. I had insurance through my corporate job, paid $250 a paycheck for insurance. My wife went to her regular appointments, paid a $25 copay each time. When the baby came we paid the hospital $300 and that was it. We had a shiny new baby. My second son was born after the recession. I had the same exact corporate job, same insurance company, but now I paid around $350 a paycheck for health insurance. When it was time for the baby to come we went to the same exact hospital, but now we were charged $11,000. We still got a shiny new baby in the end, but damn the costs changed. Primary care mid-level provider here working in a rural office in the south. It would be a game changer. The biggest positives would be that my patients can finally afford to come see me consistently. They won't have to choose between the insulin I'm prescribing, the lab I'm ordering, or the specialist I'm referring them to, and things like paying rent or buying food. Better yet, they might actually come to see me to get some real preventive care, so I might be able to find the tumor in their colon before it decides to metastasize all over to a point where the only treatment they can get is comfort care. Or they might not feel like they have to cram all their complaints into one visit because they can't afford another copay for a separate visit, even though a separate visit would get the best highest quality evaluation of your complaint. All of that in turn makes my job easier to do and less stressful. I'm no longer having to take into account the cost of what I'm doing, not that I ever really know that anyway, and instead I can focus all my energy to figuring out what is wrong with you or the absolute best way to manage your diabetes instead of rushing because I'm running behind after taking 10 to 15 minutes calling your insurance company to justify why you need a sleep study or a stress test. I went to school and dedicated years of my life to training to learn how to take care of people, not worry about the business of it. It certainly would not be all sunshine and rainbows though, as others have mentioned. An initial transition would mean a large influx of patients into primary care clinics, especially in rural settings like mine, where some of the more significant barriers to care currently exist. The primary care system is already strained as it is, so this could certainly lead to increased burnout, although I have also seen burnout defined by some as really an end product of moral injury, and if you are improving working conditions you may see less burnout. There would likely be an increased focus on reimbursement to the primary care level though, so I would not foresee significant decreases in salary to those in my position. Other specialties may suffer to some extent though. However, you certainly couldn't have Medicare for all, at least in the format Medicare exists in its current format, and expect it to be anything other than a disaster. The reimbursement is just too low. However, if you don't have the obscenely inflated charged rates by private insurances to hospital systems, and you reform the pharmaceutical company system of inflated prices, it could work okay in its current form. I think it is the only logical outcome and way to run a healthcare system. There is a reason other countries do this successfully. It would be incredibly difficult to change our system to something based on a universal coverage option from the government due to how entrenched our current system and a significant portion of the economy is into the current setup. Without careful planning, there would likely be a short-term backfiring effect with closed hospital systems clinics, which would reduce access to care, but it is the right thing for us to do. Thanks for watching. Consider subscribing for more videos.